Do you frequently feel like your heart pains sometimes? Or have you noticed unusual bruises on your skin without bumping into anything? What if I told you these signs might not just be from tiredness or aging, but could point to a serious body-wide reaction where your blood starts clotting in the wrong places and at the wrong times? This is what happens in disseminated intravascular coagulation, or DIC. Think of your blood as a delivery system. It brings oxygen and removes waste. But when something goes seriously wrong, like a major infection or trauma, your body's clotting system gets turned on everywhere, like an alarm that won't stop ringing. So, instead of helping, your own blood forms tiny clots throughout your body, clogging small blood vessels and damaging organs. And ironically, because all the clotting materials are being used up, you may also start bleeding spontaneously. It's like a car using all its fuel in the engine while also having leaks. Total chaos. That's DIC, a dangerous imbalance where the body can't decide whether to clot or bleed. So what triggers this internal chaos? Imagine your body is a smart home with automatic lights, doors, and alarms. Normally, everything works in balance. But what if a huge fire breaks out? The alarm goes off, every light flashes, and the doors slam shut, but the system gets stuck in panic mode. In the body, major events like severe infections, especially sepsis, major injuries like car crashes, serious complications during pregnancy like placenta, breaking too early, or even some cancers can act as that fire. These conditions send false signals to the blood's clotting system. For example, if you have a bad infection, bacteria release toxins that the body misreads as danger everywhere, so it starts forming clots throughout the bloodstream. Other causes include large burns, snake bites, or recent major surgeries. It's not caused by a single virus or germs alone, but by how your body overreacts to severe stress. Now, how do you know something like DIC might be happening? Remember those random bruises we talked about? Let's make it personal. Have you ever had a small cut that just wouldn't stop bleeding, even after pressing on it for minutes? Or maybe you've seen red or purple pin-sized dots on your chest or arms that don't itch or hurt. They're called petechiae. These are signs your clotting system is failing. Other clues: bleeding from gums, nose, or even in urine or stool. On the flip side, some people don't bleed but feel tired, short of breath, or have pain in organs, because tiny clots are blocking blood flow to kidneys, lungs, or brain. It's like traffic jams in your smallest blood roads, starving your organs. And because red blood cells get torn up passing through these clots, your skin might look pale or yellowish. So if someone is very sick in the hospital and suddenly starts bleeding from IV sites or has swollen, painful limbs, doctors start thinking about DIC. How does a doctor find out if it's DIC? They don't just guess. They run special blood tests. Think of it like running a system check on a computer. They'll look at tests for platelets, the little cells that help form clots, fibrinogen, a protein that makes the clot mesh, and D-dimer, a sign that clots are being broken down. In DIC, platelets are low, D-dimer is very high, and clotting time is longer. It's like checking your car's dashboard: low oil pressure, overheating, and a warning light on, all pointing to engine trouble. Treatment doesn't focus on DIC directly, but on the fire causing it. For example, if infection is the trigger, strong antibiotics and treating sepsis come first. Bleeding patients may get blood transfusions, platelets, or fresh frozen plasma to replace what's lost. If clots are the main threat, sometimes blood thinners are used carefully. The key is speed. The earlier doctors stop the trigger, the better the chance to reset the body's balance. Can we stop DIC before it starts? Not exactly, because it's a reaction, not a disease you catch. But here's the good news. By managing the big dangers early, we reduce the risk. For example, if you're pregnant, regular checkups can catch problems like preeclampsia before they turn dangerous. If you get an infection, especially with fever and chills, seeking care early can prevent it from becoming sepsis. the most common cause of DIC. In hospitals, quick response to trauma, burns, or surgery complications also helps. Think of it like fire prevention. You can't stop lightning, but you can install alarms and sprinklers. Similarly, quick medical action during serious illness can turn off the alarm before DIC begins. Scientists are working hard to make DIC easier to diagnose and treat. One exciting advance is a new test score called the ISTH-DIC score, a checklist based on lab results that helps doctors decide quickly if it's really DIC. This reduces mistakes and speeds up treatment. Researchers are also studying medicines that target specific parts of the clotting system, like smart breaks that stop only the bad clots without causing bleeding. Some drugs, like recombinant human thrombomodulin, are already being used in Japan and studied worldwide. These new treatments aim to balance the system, not just throw more blood products at the problem. It's like upgrading from an old car's brake system to an intelligent, automatic one. While still in progress, these advances offer real hope for better survival and fewer complications.